This segment of Delmarva Life is brought to you by Peninsula Home Care.
According to the American Cancer Society, not counting skin cancer, lung cancer is the second most common cancer.
Lung cancer is by far the leading cause of cancer death. Over 250,000 new cases will be diagnosed this year. The American Cancer Society estimates there will be nearly 160,000 deaths from lung cancer this year, which accounts for about 27% of all cancer deaths. Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined.
Something else that can be caused by smoking is chronic obstructive pulmonary disease, or COPD. Out of every 100 long-term smokers, about 15 to 20 get COPD with symptoms. The problem is sometimes the symptoms are vague. Dr. Yashwi Sangwan, a pulmonary specialist at Peninsula Regional Medical Center, explains how it's diagnosed.
The gold standard of diagnosis is a spirometry. That's why if any patient is referred to our practice, we make sure that we get two things. We get a lung function test and we get a chest x-ray.
There are, however, other things that smoking can affect your risk of contracting COPD, such as long-term exposure to lung irritants like industrial dust, chemical fumes, preterm birth that leads to lung damage, and inherited or genetic factors. So, what happens after COPD has been diagnosed? Well, here to explain what it's like when you get home is Sandra Russ, who's the branch director of Peninsula Home Care in Seaford. Thank you so much for coming in.
Hi.
So once COPD is diagnosed, self-care is really, really important. How do you help with that?
Once they get home from the hospital or facility they're in, we start teaching. We go over to make sure whatever the doctor or the information they got from the facility, we just reinforce what was said there, so they're understanding COPD, what it is, and the medication management, activities, their diet.
Right.
And how to prevent,
you know.
Now, one of the things that Dr. Sangwan mentioned was spirometry. Yeah, and you actually have one here. Tell us about that.
This is an incentive spirometry. This is usually given when you're discharged from the hospital, and this is to help expand your lungs.
Okay.
So did you want to try this?
So I'm actually going to try this. Okay. So what do you do?
Okay. What you're going to do is you put this in your mouth.
Okay.
And right here you want to try, when you go in, this little blue thing's going to go up and you want to keep it between the arrows.
Okay.
Okay.
And I'm breathing
in. And you're going to inhale. Very good. Oh my. Oh my gosh, that is very good. and what they'll tell you to do in the hospital, well, even when in the home, we'll tell you want to do these like 10 to 15 times right after each other. And you want to do it 3 or 4 times a day, because what that does, it helps expand your lungs. So if you have any congestion, then you'll be able to cough it.
Well, now Lisa is in extremely good health. She's a CrossFit trainer, all this kind of thing. So if someone had COPD, about where do you think that would go?
It might only get to 750, 500.
Right.
Wow.
But it's an exercise to strengthen your lung capacity and
to expand your lungs, so that if you have any congestion in there, you can then cough it up.
Okay. Now there are COPD zones, and starting with the green zone.
Right, that's where you're breathing fine, you can do your activities, and you don't have any shortness of breath.
And then second, yellow zone?
That's if you start having some coughing, increased coughing, wheezing. If you start seeing swelling in your ankles or feet, then you need to call your home health nurse, and we will get in touch with your doctor to see if we need to change your medicines, and we help with that process.
Green, yellow, there's got to be red.
Of course.
Tell us about, what is that?
That is when, like if you're having severe chest pain or you're having severe shortness of breath. If you're just there and you cannot breathe at all, that's when you want to call 911 and get to the hospital.
Serious.
Okay, so just make sure that I understand. In other words, these zones, you make sure that your patient understands them, and then that way they can self-check and say, I'm green, I'm okay, I'm red, I need to call, and you make sure.
Correct, and we have it on a piece of paper that we give that to the patient when we're out there in the home with them.
And you have other resources
correct.
For people with COPD?
Correct. We have, do we want to go over?
We have several things on the table here, but obviously we went over the spirometry.
Right, and then you have your peak flow, which is just another tool that they can use in the home to check your lung capacity to see how well you're breathing.
Right.
And then we have, this is called a spacer. This is for when you have an inhaler, and we go over the teaching with the patient and the caregiver on how to use all this.
Right.
And this is if you have oxygen in the home or if you need a nebulizer treatment. This is an aerosol.
Right.
You put
Okay.
medicine in there and then you put it in your mouth, and that'll also help open up your lungs.
Now, there are also community resources that people can go to for help.
PRMC, which is a partner with us, they have a Better Breathers program. It's once a month, and there's a number that'll be on your website that they can call to go to.
Oh, that sounds great.
And they do a lot of teaching also for the
On how to get
patient
along
too.
with it.
All right,
Sandra,
Sandra,
thank you so much. It was
Thank you.
wonderful having you
Nice
today.
seeing you.
Good
Okay.
information. And of course, if you would like to read more about Peninsula Home Care or for more information about the Better Breathers meetings at PRMC, go to delmarvalife.com and click on the show tab.